this morning. We started with our first community testing and community screening project. This is an area where we have 9 contacts who have been quarantined now. And what we've been doing throughout the morning is just doing the screening and the testing of all the individuals who stay around this area. People were willing to be tested. They were not even forced. And I think they welcomed the whole effort by the department and by the government in Gauteng.
Every day, all officials who are coming into the centers are being screened. The inmates, we are following the guidelines of the Department of Health in terms of the massive testing and screening. Hence, we have now already screened thousands of the offenders, including the officials.
We've been very busy. Every morning we start screening, we do social distancing. We screen every day about 130 patients per day. At the facility, we wear the mask and we wear the gloves. And if we need to do tests, then we use a special gown with caps, boots and goggles. When we at the facility, we tell the people to protect themselves. When they come, we ask them if they can wear cloth mask. They do have it, but we do not send them away.
We are here at Lenasia South Hospital View. Part of our lockdown and extension of the lockdown is to continue to test. Lenasia South is one of the areas where they've got a lot of vulnerable individuals who are elderly. We are happy with everything, with the setup so far. We started off with the walkabout in the Lenasia South clinic. There are 103 beds that will be open for COVID in that clinic. And it's something that we are happy about, because then it is going to give us a better extension and a better number of beds for us to be able to treat COVID patients. Today we are out here in Carousel Plaza. All our national roads will be having 24-hour roadblocks. Everyone that is coming into Gauteng will be screened, and when they are found to have symptoms, then they will be tested. And if they don't have a place for self-quarantining, then we'll be putting them up for our own self-quarantining facilities.
Not only doing COVID screening, we're also doing a whole lot of services which somehow at the beginning of the lockdown and because of the crisis of the pandemic was actually compromised, particularly your immunization program, your EPI, your extended public immunization. We also have sexual reproductive service here in terms of contraception. We also do HIV and TB screening, and we then do COVID-19 screening.